According to the given paragraph, option B is correct, and the other options, A and C, are incorrect. Let's analyze each option and quote the relevant sentences from the paragraph to support the explanation. Option A. Give information on compiling private prescriptions. The paragraph does mention recording private prescriptions, but it does not provide information on how to compile them. It focuses on the record-keeping aspect, specifying what particulars should be recorded and how long the records should be retained. Therefore, option A is incorrect. Option B. Remind the staff of particulars to be included. This option is correct because the paragraph clearly states that a record must be kept and provides a list of particulars to be recorded. The paragraph specifies that the staff should record the date of supply, name, quantity, pharmaceutical form, and strength of the medicine, date on the prescription, name and address of the prescriber, and name and address of the patient. The paragraph serves as a reminder to the staff about the specific details they need to include when keeping records. Therefore, option B is correct. Option C. Instruct the doctors of methods to standardize procedures. The paragraph does not mention instructing the doctors or methods to standardize procedures. It focuses on the record-keeping requirements for the staff. Therefore, option C is incorrect. In summary, the correct option is B because the paragraph reminds the staff of the particulars they need to include when keeping records of prescriptions. Options A and C are incorrect because they either go beyond the scope of the paragraph or do not align with the information provided.
Let's look at the next question.
According to the paragraph, the correct option is C, adhering to the laid-down structure of identification. Here's why option C is correct, along with explanations for why the other options, A and B, are incorrect. Option A, assuring help required from a GP or dentist, is incorrect. The paragraph states that some homeless individuals were not receiving the help they needed for their health problems and that 7% had been refused access to a GP or dentist. However, the paragraph does not mention anything about assuring help from a GP or dentist. It focuses more on the barriers faced by homeless individuals in accessing healthcare services. Option B, registering the identity of those uncovered, is also incorrect. The paragraph mentions that some homeless individuals were refused access to a GP or dentist if they did not have identification or proof of address. However, the paragraph does not suggest that the solution lies in registering the identity of those uncovered. The issue seems to be more about the requirements for identification and proof of address when registering new patients. Option C, adhering to the laid-down structure of identification, is supported by the paragraph. The paragraph discusses how some homeless individuals were refused access to healthcare services if they did not have identification or proof of address. It mentions that many practices request multiple forms of identification and proof of address when registering new patients. Therefore, adhering to the laid-down structure of identification means following the existing requirements for identification and proof of address. In summary, option C is correct because it aligns with the paragraph's mention of the need for identification and proof of address when accessing healthcare services.
Let's look at the next question.
According to the paragraph, the correct option is C, identification and management of malnourished patients. Option A, the requirement for monitor of malnourished patients, is incorrect. The paragraph does not mention anything about a specific requirement for monitoring malnourished patients. It focuses more on the importance of identifying patients at risk of malnutrition and providing nutritional support. Option B, primary route for providing external nutritional support, is also incorrect. Although the paragraph mentions enteral nutrition as the first-line route for providing nutritional support, it does not state that it is the primary route. The paragraph provides general information about malnutrition and the use of a nutritional screening tool. Option C, identification and management of malnourished patients, is supported by the paragraph. The paragraph emphasizes the importance of identifying patients at risk of malnutrition and mentions the development of a malnutrition universal screening tool by the Malnutrition Advisory Group. It also briefly mentions enteral nutrition as the recommended route for providing nutritional support. Therefore, the advisory intends to convey the need for identifying and managing malnourished patients.
Let's look at the next question.
According to the paragraph, the correct option is A, approach to be considered on the length of stay. Here's why option A is correct, along with explanations for why the other options, B and C, are incorrect. Option A, approach to be considered on the length of stay, is correct. The paragraph mentions that patients want to know how long they are likely to stay in the hospital and be provided with information about their treatment and discharge. It states that predicting a patient's length of stay can be based on actual performance in the ward or unit or on benchmarking information. The paragraph also mentions the Department of Health's discharge guidance, which states that the estimated date of discharge is based on various factors. Therefore, the Directive on Discharge Plan outlines the approach to be considered for the length of stay. Option B, need for the patient's choice in the duration of stay, is incorrect. The paragraph does not discuss the patient's choice in the duration of their stay. It mentions that patients want to know how long they are likely to stay, but it does not indicate that the patients have control over the duration of their stay. Option C, use of systems to estimate the course of admission, is also incorrect. While the paragraph mentions the use of systems to estimate the length of stay, it does not specifically refer to the course of admission. It discusses predicting a patient's length of stay based on actual performance or benchmarking information. The focus is on estimating the duration of the stay rather than the course of admission.
Let's look at the next question.